Hello, everyone, and welcome to this CAQH webinar, Streamlining Delegated Roster Sharing with Centene Corporation. My name is Rebecca Beatty. I am Senior Product Marketing Manager for CAQH, and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details for all those listening today. Today's session is being recorded, and by the end of the day tomorrow, you will receive a link via email to the on-demand webinar that you may share with others. The recorded webinar will also be posted tomorrow on our website. Your phones will be muted throughout the webinar today. All questions should be submitted online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel, and we will address your questions at the end of today's presentation. Now I'd like to introduce today's presenters. They are Tina Lonhart, Senior Manager of Corporate Credentialing at Centene, and Becca Sandler, Product Manager at CAQH. I will now turn the presentation over to Becca.
Great, thank you everyone. So today we're going to talk about the CAQH solution called CAQH ProView for groups. We'll first give an introduction on what the solution is and how we sought to solve some industry challenges by creating a solution to help with delegated data exchange. Next, we'll get into the details of the solution, some features of the product. And then I'll hand it over to Tina, who's going to talk about what Centene's experience has been as they've adopted CAQH ProView for groups. So at a high level, what we were hearing from our plans is that there is a challenge with sharing delegated data throughout the industry. Some of the main pain points when a group is delegated with a plan is that they're sharing data with a plan in varying formats. Many times in both a change report separately from a full roster. They're sending those two different formats at varying frequencies as well. So not on a predictable cadence for the plans to be able to make sure their staff are available to make those updates. In addition, because of this manual labor on the group side, the data is oftentimes inaccurate or not applicable to the health plan. So in a way, the plans are also having to clean up a file even once they get it to make sure that the data that they're retrieving is correct and that it's applicable for them. On the group side, we were hearing often similar complaints that they're having to maintain different files for each health plan, different change reports and different rosters, and that they don't often hear back timely from the plans on whether they've processed the changes or full roster file. What this has led to on both the plan and group side is excessive resources to handle the manual nature of the delegated data exchange process. Groups have large amounts of staff to manage the updates of the file, and plans have large amounts of staff to handle making those updates within their systems. This has also led to poor data quality, meaning the error-prone results on both the health plan and the group side. Oftentimes the directories themselves are outdated because either the group hasn't sent a roster in the last few months or that the plan has made some error as they updated their internal systems because the files are disparate and hard to make sense of. So given these issues, we brought together both plans and groups across the industry of different sizes and different regions to really develop a mutually beneficial solution. We analyzed over 50 files from our CAQH member plans. We've conducted over 150 phone calls with over 35 groups to make sure that the data that we're talking about exchanging here is all standard and necessary for both delegation oversight, directory maintenance, and enrollment. So part of that discovery process was these discussions and analyzing the data set. But once we knew we had a standard data set agreed upon by both plans and groups, we really dove deep on understanding what the portals should look like for both the plan and group experience. So we leveraged those same groups and same plans to receive active feedback on the user experience process, what types of files they would like to receive or be able to submit, and then did a beta test this summer starting in July through September, where we allowed those plans and groups to interact with the system, create real files, submit them, download the outputs, and really test the functionality and enter any requests for enhancements before we went live. What we've created here is a one-stop shop for provider group data, building on the already existing one-stop shop for individual data here on ProView. What we really attempted to do is now expand the universe that CAQH ProView supports by allowing groups to submit bulk information so that they can send that delegated data in a standard way. At a high level, just to walk through how the solution works, groups begin by entering all of their data for all of their health plans into a single roster. So this really streamlines their data entry process. Within our file, they can specify which plans the data is affiliated with, and that will be filtered out by plans. So plans will no longer get extraneous information that's not relevant to them. Once they upload this standard roster, it goes through over 120 error checks to make sure that the data meets our requiredness, our formatting, our logical data rules. And if it doesn't, they receive automatically an error report real time, asking them to make those corrections before they try again. This error report can be downloaded to their local computer and used as a work list to make corrections. Once they've made those corrections, they can now re-upload the file and confirm that it's accurate to the best of their knowledge. At that point, we send a notification to any plan who has subscribed to receive the group's data, and the plan is able to log into the existing CAQH plan portal and download a real-time extract and change report. So on-demand plans can now come when they're ready to receive that information and download either that full data set, is what we call an extract, or they can download just changes between two roster submissions. Once the plan accesses that information, they can now complete any data updates needed to enroll, terminate, or update directories. Overall, you can see that our solution really offers some benefits to reduce that manual work while also improving the data quality. With the standard roster, the groups no longer have to maintain disparate files and send those over email at varying frequencies when they get around to it. Instead, plans can now receive that data in a standard format, and it will be filtered for their specific health plan. Because there's reduced manual effort and a standard format that some groups have even been able to automatically generate from their internal provider data systems, there's better data quality overall. So with the standard format and with the 120 error checks, we've now improved a large percentage of those errors you may be seeing in the data today with your delegates. And lastly, because there's a standard output options on both the extract and the change report, plans are able to easily integrate this information into their system and create some automation, which speeds the updates of data changes. To double click here on what the roster experience is for groups, they are able to upload that one standard file, as I mentioned, with data specific to each plan. So the screen you're seeing here is what the experience is once they've already submitted something. You can see that we store their current roster, the current version of their information at any time for them to come and retrieve. What they can do is then just download that, make any changes, and then re-upload it to our solution. Every single time the roster is submitted, we are checking those 120 rules to make sure that it meets those. If it doesn't meet all 120, then it will be rejected and they will have to make corrections and improve the data quality before they can submit again. In addition, one of the benefits of the one-stop shop for groups is that automatic calculation of a change report. So they no longer have to track every single change they make every single time they need to make them. We will automatically calculate the changes between each of their roster submissions. As I mentioned, they will receive a real-time error report as they submit their roster. And this single roster format has actually allowed several groups to automate the generation of this standard roster from their solution. And lastly, they're able to review not only the delivery date of when the plan downloaded their data, which in previous to ProView, they had no visibility into when the plan had actually opened and started to process the file. They can actually download the exact same change report or extract that the plan received. They can see the date that it was received, and as well as the information that was embedded in those reports. Here you'll see what it looks like when they download that error report. These 120 quality checks really are the crux of why this data quality is improving. So previously, things such as NPI that were just completely missing, or specialty that was not in a standard format, are now being corrected. So we have error checks that check for all of these things real time as the user is there trying to upload their roster. In terms of categories, this is how we categorize the quality checks themselves. We have the formatting errors, so it has to be in Microsoft Excel. Specific column headers are required. We validate exact field formatting, such as tax ID, NPI. And then specialty is an example of a reference table that we've implemented, which matches exactly to NUCC. So both taxonomy and the specialty name itself must match our reference tables. In addition, we've agreed upon a standard data set that's required versus conditionally required and optional. So our groups must submit all required or conditionally required fields, if applicable, every single time they submit that roster. And lastly, we prevent all duplicate providers and practice locations from being submitted. In addition, we don't allow provider groups to just delete out rows of providers and send the file. They have to explicitly terminate them and let us know what date that we should transfer to you as an effective date for that termination. So no longer will you be wondering whether those providers were actually termed or accidentally deleted. This covers about 72% of the common roster errors you're seeing in your existing delegated process prior to ProView. So as I mentioned, this is a large swath of the issues you're experiencing that can be prevented just with the quality checks. In addition, the standard roster itself has been shown to improve the quality of the data. So if you're a group and you're maintaining 12 different files because you have 12 different plans that you're working with in a delegated way, it's very difficult to remember whether you've updated Dr. Rebecca's license in all 12 files when that needs to be changed. And so here, with a one-file approach, with standard data set, with requiredness being enforced, with reference tables being enforced, groups are inherently forced to clean up any types of issues that they may have previously been having just due to the nature of the disparate files by converting to that standard format. On the plan side, as I mentioned, this feature, CAQH ProView for Groups, is available within the existing plan portal today, so you would not get a new password or username. Within the portal, you can see all the groups that you've subscribed to and request their information on an on-demand format. So both a change report and an extract are available at any time for you to come in, select which date or which date range for change report that you're interested in. And once you click the submit button, it will automatically generate and download to your drive. These formats right now are in Excel to facilitate early automation as needed, but also because many of the plans are using manual labor to process these still. While we realize that we're also building a JSON for those plans that are ready to automate even sooner. We also track and log all group activities, so you can see all previous confirmations of a group. You can see their key identifiers, as you can see on the top left here, just to make sure you're looking at the right group. You can also sign up for roster notifications or change the plan name to display to group, which allows you, if you have a specific name in a specific market or just for one group, they may know you by something different, you're able to customize that by group. In addition, this is all plan specific. So while the group submits one standard roster, they have to tell us which plans the information they're submitting is applicable for. And that will be completely filtered out on the output side. So you will not receive a different plan's information anymore.
Becca, we have one question that's come through. Can you repeat the source for your reference table for specialty and taxonomy data?
Yes, it is NUCC. And I don't know the exact name off the top of my head, but we can certainly get that by the end of the call. Great. So when you sign up for CAQH ProView for Groups and invite your group to join, we are partners with you to bring them on board. So we have a library of materials. We have dedicated teams. So we have an implementation manager dedicated to helping your group submit that first roster and getting familiar with the system. and also a dedicated provider engagement team member who will help reach out to the group once you've invited them and give them a demo and help explain why this is valuable for them. I mean, the ultimate goal is to really help the group realize that once all their plans are signed up for CAQH ProView for groups, it's truly a one-stop shop. And so getting them on board is part of what we're here to help with. Here you can see a sample of the groups that are already participating. We, like I mentioned, we worked with these groups here to help design the solution from day one, but also these are our early adopter groups that are already using the solution to submit their roster for their health plans. So we made sure to use a variety of geographies and sizes to make sure the solution can meet any size group's needs. In terms of the experience to date, what we're hearing is positive for both plans and groups. The plans are loving the ability to come to one portal to not only get their individual provider data, but now get their delegated group information. You'll hear shortly from Centene, who can kind of walk you through their experience as well, but just having one place to go that's on demand, they don't have to search through emails anymore or don't have to wait. You know, if they're not getting a file within their expected time frame, they can always just come and get the latest and greatest from CAQH ProView. On the group side here, also similar feedback about the one-stop shop option. It's really straightforward. The one file format is really helping them clean up their data. They even feel like they've won the lottery when they have no errors. I think the benefits of delegation have been lost in the disjointed manual process that exists today, and so both plans and groups are realizing more of those values of the value of delegated arrangements through adopting CAQH ProView for groups.
What logic is being done to ensure no duplicate locations are being entered? For example, 123 Main Street, Suite 100 versus 123 Main Street, Department IM, Suite 100.
Yep, so that's a great question. So we have heard from both the groups actually and the plans that just including address as the duplicate flag is not sufficient because they may actually want to attribute different information for the same address. So, for instance, if they have Suite 100, but they have a different appointment phone number for their cardiologist than they do their acupuncturist, or whatever it may be, they can still use our file and still submit the same exact street address per se, but they have to change something else. So they can't just duplicate the entire data set and demographics of the location, but they can use the same street address as needed because that is a use case we've heard. And before I hand that over to Tina here, just the NUCC stands for National Uniform Claim Committee, and you can find the list that we use on www.nucc.org. All right, thank you for your time, and I'll hand this off to you, Tina.
Hello, good afternoon. I'm happy to be here. I'm Tina Lonhardt, I'm the Senior Manager of Credentialing for our Centene Corporation. And just a little bit about Centene Corporation before we start. We provide access to high-quality healthcare, innovative programs, and a wide range of health solutions that help families and individuals get well, stay well, and be well. We are in 31 states with government-sponsored health plans and also 2 international markets. We have over 300 integrated solutions across Medicaid, Medicare, health insurance marketplace, and we also have specialty companies. We have over 45,000 employees. We're very focused on timely, efficient, and accurate end-to-end business processes, and we support over 14 million managed care members, including TRICARE. So that's a little bit about Centene Corporation. And if we'll go to the next slide, we'll talk about some of the challenges that we have had with our previous roster maintenance process for delegates, and it's probably not, the experiences that we have had is probably not unique to our corporation. In discussions with other health plans during this process, I think we share the same, some of the same issues. Current maintenance of the roster process has been inefficient in many ways, using email often as our source of receiving these delegate rosters. And then that creates the need to then create a homegrown solution for tracking the rosters, because of course it's important to collect the rosters and then also to keep track of them, because as you know, for NCQA and state requirements, federal requirements, we are required to track rosters and that data that we receive from delegates. The formatting of rosters has been difficult. We do have a template that we use and that we suggest, and we really like our delegates to adhere to, but it's not always easy for them to do that, because they're not only providing a roster template for us, but they're also providing those separate type of format or template to other health plans. So oftentimes the groups then have to provide one template to us and then recreate their spreadsheet, format their columns, et cetera, to provide it to other health plans. So with this solution, it helps to have that one template. It's all the same data. We all require pretty much the same data, some more than others, some less than others. But in order to automate our processes, which makes our processes faster, more efficient, and more accurate, it's very helpful to have the delegates provide their data in one format that we can easily consume, so that we may enroll into our system. That gets it into our system faster, and then that allows those providers to be in our provider directories faster, claims payment faster, and more accuracy all around. What we've dealt with in the past, and we still do in some respect, because we don't have all groups on this solution yet. Our goal is for all of our delegated groups to be within the solution, because we find significant benefits. We've had a lot of manual work around to validate rosters and also to reformat. And it's as simple sometimes as we're getting all of the data from our delegates, but what we have to do is take significant amount of time to reformat the data into the columns or into the right data set that we need then to enroll into our systems. So those are some of the challenges that we've had with the previous roster management process. And again, that email is just not an efficient way for us to collect those. And if we'll move to the next slide, we'll talk about some of the benefits and why Centene has chosen to go with CAQH ProView for groups. It really is simple. The system is very intuitive. It's one location that we can go to, and if you've used the CAQH for credentialing applications, it's nice. It's very similar. It's on the same login. I don't have to come up with a new username and password. It's the same site that we can collect credentialing applications, and I just go to the provider group module, and it's very simple to use, because we have our groups who have authorized us to use their rosters, and we can just click on that group and get their updated roster. Again, there's a dedicated support team from CAQH to help our groups as they have joined this solution, so they're not alone in trying to format their data. We've had a really, really strong partnership with CAQH and with those groups who are going through this process. Again, I talked about for audits specifically, we've got to track those reports and the rosters that we received. This system has made it easier to do that, very helpful. And I can go in, for example, if I needed to, multiple areas of our organization use delegate rosters for different reasons. We have, obviously, the main piece is to make sure that we can consume the delegate roster information so that they can be enrolled in our system for provider directory, claims payment. We also use it for audit. We are always audited by NCQA, federal and state, and so we do need to keep track of our rosters and the data and make sure that we are putting into our systems the data that our delegates provide to us. So this has been very helpful for me to be able to go in. If I need a certain data set, for example, I only need, the credentialing information and the first name, last name, specialty, I can go in and collect that myself, where they don't need to go back to our provider enrollment team to then ask them for that information or to glean a subset there. That's just one example. But it's one-stop shop for all of that individual and group data. It's just been very helpful for me. We want to move to the next slide. We'll talk about how we recruited our delegated groups, and we're still actively engaged in this for all of our delegated groups. But we have had, with partnership with CAQH, we've got, as we talked about, an account representative who helps us with this. So we've identified delegated groups. At first, we started with groups at other health plans who were engaged in this, the testing program and the piloting of this solution. So we sort of tried to find groups that all the health plans had in common to start with so that we could test it appropriately. And then now we're expanding those groups. So what we started with essentially was I would introduce CAQH to the groups and the organizations, just providing my contact information. We provided, sent an email out to our delegated groups introducing it, and then our CAQH provider engagement rep also was involved in that email and provided a demo for our groups. And the initial reaction from the groups that were able to see the demo was pretty positive. They were very excited about the solution. I've also gone and discussed with groups during pre-delegation audits with our groups, as well as annual audits, and any time that I talk about it, the provider groups have been very excited to have this ability to have one standard template that they can enter in one time into the system that most of the time they're also already using for their own credentialing applications. They have one place where they can enter their data, and then it goes out all at once to multiple health plans. So we've had a really positive reaction from those delegated groups. If we move to the next slide, we can talk about some of the benefits. I think to both Centene and also for our groups, it's a faster process, as we've talked about. So once our groups are able to get their data into this format, it's much simpler for them to do updates, and that standardized roster format doesn't require reformatting from either the group. Once they've done it, it's formatted, ready to go for them and for us. In order to consume that data, it's in that standard format, and then we're able to put it into our system so that we can have more automation and batch these rosters into our systems so that it's much faster and more efficient, which would then create that shorter turnaround time, which we all want, making that enrollment faster. Again, transparency. It's difficult when you're tracking emails and you're trying to respond back to emails. When you're using that kind of a communication system, it's just not as efficient, and you can't always respond back timely to that individual delegated group to let them know, yes, we've received this roster, we've enrolled it. Having it visible to them in this system makes all the difference in the world. They can see that we actually are going out and collecting it and taking that information and using it. And again, a way for us to note when we receive a new roster or a new data update. Very helpful. And again, cleaning up those things like those addresses, having a standard set of addresses so that we can then enter it into our system makes it much easier than having to go back and reformat street from STREET to ST. Simple things like that. This has given us better efficiencies as well. And then there's additional data that, as we all know, we need to have appropriate addresses, phone numbers, board certification information, and our delegates are a key part of making sure that our provider directories are accurate. So we're able to require this information and then be able to enter that into our systems timely. multiple areas, I think, as I talked about, can access the data that we need, and it's all in one place. So those are the main benefits that I would say that we have found using this solution so far. And I anticipate even more as more of our delegated groups come on board.
Great, thank you so much, Tina. So now we will go ahead and open up for questions. Again, please submit your questions by entering them into the questions section of the panel on the right-hand side of the screen. We did have another couple come through while you were speaking. So this question I think is for Becca, but Tina, you may also have some insight here. A question is, what are some of the reasons that groups don't want to participate, and what steps are we taking to address those concerns?
Yeah, so we have had some groups push back, and I'll let Tina comment as well, but mainly, at least from what I'm hearing, is it's hard to justify if there's only one plan for them, because then, using my example from earlier, if they have 12 delegated arrangements and only one plan has bought into this, it's hard for them to justify. Now, that being said, we have had some groups, despite only having one plan, realizing the long-term value, and then they'll try to turn around and recruit the other 11 plans that they are delegated with to try to come use ProView. So we are here to help the group. We have a library of recruitment tools to help them go recruit their other plans, but also just have our sales team working as hard as possible right now to get as many plans on board. So it's kind of a chicken and the egg in terms of getting the group in and the plan in at the same time so that both sides realize the value. In addition, the other reason sometimes is that if a group has been able to dictate their own format just because of their market power, so if they own an entire city and they're that big and they've been able to just force their health plans into using their format, it's more of a difficult sell to them. That being said, we have had a group that was in that exact scenario come around when they realized the long-term value of, well, if I move to this, then all of my current plans that are using it will be able to use it. And then also I'll get some data quality improvements and just some streamline improvements from only having one format with all of my health plans information in that.
Tina, did you have anything you wanted to add?
I think she covered most of those things. Again, it's a chicken and the egg, like you said. I think once they see it and they experience it, they would be more open to it. And just from my experience in some of the groups who might have had some difficulty getting started with it, once they see it and then they work with the account rep, it seems like they've turned around and we've had positive response, because it's not as if they're doing it alone. They're getting help all the way through with that. So it's just a matter of, it's something new, and sometimes groups are very adamant about not wanting to change, but it does seem with the groups that we've had success with, once they've seen the solution and tried it and just listen and understand the partnership, we've had some turnaround.
What is your source of data governance for standardizing addresses? Is it USPS or other?
Yes, so we're going live here in another week with the USPS standardization. So we do use that standard USPS API.
Okay, thank you. In terms of the purchasing structure, does the plan or the group purchase the product?
Yep, so this is paid for by the plan. It's completely free for groups to use, and the pricing is per provider per group.
Okay, and if you have any additional questions specifically about pricing, you can contact sales at CAQH and they can give you some more details about the pricing. Another question, what is the average ramp-up time that other MCOs have experienced?
Yeah, so from a health plan's perspective, the ramp-up is fairly quick, and I'll let Tina comment, but it's really just assuming if you're already a ProView customer, you already have a username and password, and it's just a matter of signing an amendment to the ProView contract, and then we give you access to that new section in the portal. Within the portal, it's just a matter, like I said, of downloading that data when you're ready and your groups have submitted it. And then internally, the plans, what they're doing once they download that data is baselining. So that first roster that they get, they'll do a cleanup of the original data that they've gotten, which can take some time for sure. But in terms of the actual implementation on the plan side, it's, I want to say within minutes, but let's just say, a couple hours. I don't know, Tina, do you mind commenting on that?
Correct. So because we're so used to getting rosters in multiple formats, since it's in one format, it is much easier to collect and consume. I don't know that it's within minutes, because there's still some things that as a health plan we have to do, because we've all agreed on this data set and this standard template to get it into ours, that we still have to make sure that it's in there's some things that we've had to do to make sure that it will work into our automated system.
Yep.
But that you set up once and then you're ready to go.
Yeah, that's a good point. So on the time it takes from a true CAQH ProView sign up, from MCO signing the amendment to when you have access, that's the shorter pull. I think to Tina's point, once you get the data, it depends what your internal processes look like today in terms of how quickly you can ramp up and use that data, especially in an automated fashion.
Okay. Another question, if a provider practices at several locations, are all locations listed in the directory?
So that is up to the plan. We do have a directory publish flag that explicitly asks the group to say by location and provider combination, should this be published in the directory for this plan? So if Dr. Becca practices at 123 Main Street for Plan A, but that shouldn't be published in the directory for whatever reason because she's only practicing there, once a month, then the group is able to indicate that she is practicing there but not frequently enough to publish in the directory. Whereas if she's also practicing at 456 K Street, they can indicate that separately should be published in the directory because she is actively taking appointments.
Okay. A question about group adoption. So how quickly were we able to get the first set of groups on board, and what has adoption looked like this year versus last year?
Yeah, so we actually just went live in October. So what we did is we had a beta of about 13 groups through the summer. So getting them on board, it was a little bit of a different discussion because they were early adopters and they were really helping us define the solution versus just a group today who could sign up today and start using it tomorrow. So what we've been seeing in the last few months is actually a good uptick in what groups are coming on board. So Tina and Centene have been great at inviting their large groups to join and become part of this. So we're in the implementation process with, I believe, upwards of 15 different groups right now, and also talking actively in recruitment discussions with another 15. Those are just active conversations. Certainly we know there's hundreds of groups out there that are opportunities for us to go recruit.
Okay.
And I'd like to note real quick too, and I did mention it earlier, but there's a great way. I mean, not only can I provide contact information and introduce our groups, but there is an option within the system that I can invite through the solution, through CAQH, the provider group section. I can invite, and they'll get an automatic email. I think it's important, of course, for us to do that introduction and the personal introduction, but there is that other avenue, which I think is helpful as well.
Yeah, thank you, Tina. That's a great point. Another question, how often are groups required to update their rosters, and how do you enforce that?
Yes, so we went live without a true requirement, mainly to see if we could figure out what a normal cadence would be, as well as the delegated contracts are very different across different health plans, different markets within a health plan. So some groups were not required per their contracts previous to submit but once every 6 months, some every month, some every 3 months, some every 4 months. So it was all over the map. So we launched with the idea that we would kind of see what the normal cadence is and see if it really was important to enforce, because the groups still aren't doing it frequently as in the previous process. However, what we've seen is actually great news, is because to Tina's point about once they get that first file in, it's a lot easier to maintain and make updates than previously. They're submitting rosters on average every 2 weeks or less. So the groups that are participating are very active with their updates because it's easy to do. So we haven't yet seen a need to enforce any amount of time frame, though we're looking to create a consensus around that if we did, so we could standardize around a certain time frame where we would expire rosters like we expire providers.
Okay, thank you. A question for you, Tina. Have you considered mandating that your group to use CAQH ProView for groups or offering it as an option? And are you able to require groups to use this method?
Well, at this point, I mean, we certainly have considered that, mandating that our groups use it. At this point, we're not ready to do that. We really are in the beginning phases of using this, and then we have so many delegated groups that at this time we can't. But I do see us going forward with that sometime in the future. But again, we really can't do that just yet. And I think it's going to help to have other health plans. You know, as we all know, if we're not all doing it, it's going to be more difficult for us, for one health plan to ask versus everyone, all the MCOs.
Absolutely. Does this file include multiple types of addresses, like practicing, covering, vending, correspondence, or only practicing addresses?
So what we support within the file is by location. The group can submit not only the service address, but also a billing and a correspondence address.
Okay. And what is the list on the group side to include and exclude different plans from their roster?
So we have a very flexible way that the groups can use this plan affiliation method within their roster. So they can either submit the word all in this plan field, and we will only share that information with all of their authorized and subscribed plans. So if they're a group that doesn't have a lot of changes by plan for each provider at a location, they can just use the convenient feature all. In addition, we allow them to comma separate ID. So if they need to tell us about Dr. Becca at 123 Main Street, and she's a specialist there for all of her plans, but she isn't a specialist for all of the group's plans, they can actually comma separate the plan unique identifiers, and we'll only send it to those 2 or 3 or however many plans, but not the others. And lastly, they can always just put one plan ID. So if Dr. Becca's at 123 Main Street as a specialist for one of their plans, but she's actually a PCP at that same location for a different plan, they can indicate that within the file.
Okay, thank you. Someone is asking where they can access the presentation after the webinar. We will send you a link to the recording tomorrow that you are welcome to watch anytime or share with others. Someone else would like to know, how is this different from regular ProView?
Yep. So that's a great question. So what, in a lot of ways, so one is that this delegated roster is a bulk upload data set. So the group admin is able to submit data on behalf of all of their group providers that are in that delegated arrangement. And that data set is certainly overlaps with the existing individual provider application that's supported on Core ProView, but it's not one-to-one in that in a delegated relationship, the plans don't often need that full credentialing application. They don't need disclosure questions, for instance. So that group roster doesn't contain that additional information. It only contains the minimum necessary information for that delegation oversight, directory maintenance, and enrollment. So some of the fields, like I said, certainly do overlap. So especially on that directory maintenance part. So the locations, the address of the locations, the office hours, the billing information, that type of thing certainly overlaps, but there are less fields on the group roster than that are required on the individual provider application. In addition, Core ProView certainly has lots of different outputs and formats that you can pull on an individual provider basis. So you can pull, an XML, an ASCII, you can use our JSON, all of that good stuff, especially within that portal, there's lots of options. So the difference here being that within that same portal, this is a different section where you can go and retrieve Excel outputs for your delegated groups.
Okay. Another question for Tina. For another plan who might be considering this solution, do you have any lessons learned for a successful implementation?
I think just really partnering with your account representative and then with your delegates, really having that good communication with your delegates and with the CAQH account and connecting them, helping, just being available to answer questions and just to support the solution. I think if you present it to them, even if you're able to share it, they seem pretty excited about it. So it hasn't been difficult once I've shown the groups and once they've seen the demo. It's a matter of them worrying about, I guess, how they're going to map their data to this template. But I think the key is just to stay connected with them and then and for them to get with the account rep to help, because I think that the assistance is there. And I probably haven't even been able to use all of the library of information, but I think that's something I'll be looking at more to provide, because as I said, we haven't started with all of our groups on this yet, but I think using that, CAQH has come up with additional helpful resources to be able to present. So I would just say, just really actively engage with your account representative and then with those groups.
Great. We had another question. It was mentioned the pay structure is by group, by provider. Is this on an annual basis or is it more frequent, such as by download?
Yep. So plans are billed on a monthly basis for the providers that are on that group roster in that month. So it's actually dynamic by month.
Okay. Great, thank you. I think that is most of the questions that we have received. So just wanted to quickly give a short plug. We are having a ProView symposium taking place on May 22nd and 23rd, which is a great opportunity to network with your peers from other health plans and learn best practices for addressing common provider data challenges. Registration for that, if you are interested in attending, will be available online shortly. And if you have any questions, you can contact our event manager, Crystal Page, at cpage@caqh.org. Okay, this concludes our webinar today. Thank you very much for joining us. As a reminder, tomorrow you will receive an email with a link to the recorded webinar that you may share with your colleagues. You can also learn more about the solution at CAQH ProViewForGroups.org. And of course, you can email our sales team at sales@caqh.org for more information anytime. Thank you again for joining us, and goodbye.